Hello, and welcome to Keynote. I'm your host, Elizabeth Moore. In our August episode, we marked National Immunization Awareness Month with Dr. Rebecca Choudhury, an infectious disease physician and assistant professor of medicine at the Icahn School of Medicine at Mount Sinai. In this month's keynote, Dr. Choudhury offers some peace of mind as she walks us through the extensive approval process that all vaccines undergo to ensure their safety and effectiveness. I think a lot of people call into question the safety, but the safety protocol that vaccines go through is extensive.
Yes, it takes a very, very long time to get a vaccine from the research lab to out into the world for you to get at your doctor's office. Even the process of just deciding what type of vaccine is going to be most effective, actually creating the vaccine takes a long time. Mm-hmm. From there, the vaccine is tested, in a lab on cultured cells, like in a petri dish. And if that looks promising, then we move on to testing it in animals. And if there it demonstrates a certain level of safety and effectiveness, it goes to what we call phase 1 clinical trials. So these are trials that involve a very small number, like 100 healthy volunteers. And at this stage, we're looking for signs of effectiveness of the vaccine, but also safety. And when those certain benchmarks are met, we go into phase 2 trials, a slightly larger group of people. Often here, we're aiming for diversity to make sure the vaccine is going to work in a broad range of people. We may also focus, if the vaccine is intended to benefit a certain population, older adults, pregnant people, we might try to recruit from that specific group. And then phase 3, even larger group of people. And phase 3 is the part where we are thinking, okay, this is a vaccine that really might be beneficial to the general population. And so this is when safety organizations like the FDA get involved, not only to review the trial data to make sure that the vaccine is actually shown to be effective, shown to be safe, but also things like the manufacturing process to make sure that the vaccine manufacturing is being done safely and consistently so that one lot, that is like one batch of the vaccine, is going to be the same as all the others. So this is a very rigorous process. At any stage of development, a vaccine may fail, so to speak, because it's not working well or there are safety concerns, and kind of start over, from the beginning or be scrapped entirely. That's why normally this process takes a decade or more. The case of COVID-19 is kind of a special one because in response to the pandemic, we had scientists from, all over the world, from both governmental agencies and private industry, all working together and building on, research that had been done before, again, since the late 1980s. And, that's the reason why it was able to be rolled out so effectively, or so quickly, I should say, not because any steps were skipped or anything like that. I think it's a real testament to what we can accomplish, with that kind of motivation and that kind of international cooperation.
Mm-hmm. That's really reassuring to hear. I'd love to hear how extensive it is. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.